today with Dr. Malik Kahook, and we want to talk about the Harmoni modular IOL, and we'd like to know more about the technology behind it, the innovation that led to its development.
Sure.
Could you explain about that?
Right. So the Harmoni lens was started by a company called Vista Medical. Vista Medical was born out of a laboratory at the University of Colorado, and the technology really centers around refractive eye care. So think of it as fitting into the intraocular lens market. What we've done in Vista Medical is we've taken the typical concept of a one-piece intraocular lens and we've improved upon it to really take it to the next generation of intraocular lenses. And specifically, what does that mean? That means that we've done three things to improve on outcomes after cataract surgery. The first one is we've decoupled the optic from the rest of the lens. So there's a base component and there's an optic component that goes along with that. In doing so, we've added less than a minute of surgery to each case, and we've given the surgeon and the patient the flexibility to upgrade the optic, so going from a monofocal to a multifocal, or if the patient got an original multifocal and wasn't tolerating that, then the exchange of the lens to go back to a monofocal is much simpler. In addition to that, by decoupling the two pieces, we've decreased the rate of PCO, posterior capsular opacification, because now we can make some modifications to the base that weren't possible with a traditional intraocular lens. And the final piece, and probably the most exciting piece of all of this, is that the base component now acts as a CTR, so a capsular tension ring. And when you put the base in, the effective lens position is much more predictable. So you can pick and choose which optic has to fit on top of that base, because the ELP is now predictable and can factor into the calculations, and you can hit 20/20 or better vision more frequently than you can with current technology. I'll just finish by saying that this novel intraocular lens, the Harmoni lens, also does very well with the new intraoperative aberrometry technology. So for example, WaveTime, in that you can use the intraoperative aberrometry to help select the right optic now that the effective lens position is more predictable. So it just gives a lot of flexibility, and it's an innovation in intraocular lens technology that I think is pretty exciting.
What has the physician feedback been?
So we've had a few cases right now done in the Philippines. So our first in-man trial started about 6 weeks ago. We have a total of 20 patients who've been implanted. And the most important feedback that I've heard from the physicians is that it doesn't add much time to the surgery. So the implantation is about 60 seconds of added time to get the optic in place, which is tremendous because that extra 60 seconds gives you so much flexibility with what you can do intraoperatively and postoperatively. And then we've also heard from the patients that their vision is excellent, and then they're not having any issues like glare or problems with the lens component itself. So it's been pretty exciting. Both physician and patients have given very positive feedback.
Okay, thank you very much.
Thank you.
That was very helpful.